I've lost.
Hi everyone, this is Julie with Indivisible Midlands. We are here at Joe's office. There he is right behind us. We are here to talk about the CBO score today that is supposed to be out. CBO, I got beef with you. I needed you to do this at noon for me, but that's alright. We're working on it. So anyways, there's inclement weather. Joe is peeking, hiding from behind me, just like Spicy. So we are just going to read, for each balloon, it's 1 million people that would lose coverage estimated under Trump care. So we're going to pop balloons and talk about the people who are going to be most affected by this terrible legislation. And here we go. Oh, Kim just popped one. So that 1 million was for all the women who use Planned Parenthood for basic care, for any sort of reproductive care. This bill defunds it. That's why we have the pink balloons for Planned Parenthood. So that was our first one. Who wants to go next? Number 2, do you have a kid who was born with an expensive, life-threatening illness? Mick Mulvaney says you don't need help. He says you need to work harder. Medicaid will be cut. Sick kids will be hurt. Number 3, so this bill actually makes being a woman a pre-existing condition. It would allow insurers to rewrite how they have to insure essential health benefits and pre-existing conditions, and things like breast cancer, having a child. Basically, being a woman will be punished. Again, hence the pink balloons. Veterans also rely on Medicaid. 1 in 10 veterans is on Medicaid, gets help through Medicaid. If it is cut by this $800 billion number in the Trump care law, and then also by the budget even further, those veterans will be left in need. If you can see, that's our tweet that Joe Wilson didn't even read this bill. So we're here to inform him of what's in it, and also who's going to be affected. Another balloon. That's another 1 million. Those are for people who are in the marketplace. There are 22,800 people in Joe's marketplace who depend on their marketplace insurance. The GOP has been long sabotaging the ACA, leaving premiums to rise, and 22,800 of his constituents will be threatened. Another balloon. Oh, special needs programs in education. So kids who are on Medicaid and receive special education through our public school system rely on Medicaid. If it's cut and schools aren't able to give them the assistance they need, that's going to be tough on their families. Nursing home care. So 75% of nursing home beds in South Carolina are funded partially through Medicaid coverage. If you have a relative that is in assisted living and relies on Medicaid, their coverage could be cut, leaving your family to pay more and potentially have to move them somewhere less expensive, which no one likes to do. That's another 1 million. So we'll say that one is for people who rely on expensive prescription treatments. Trump Care does nothing to fix pharmaceutical prices, does nothing to increase transparency, and if you pay high drug prices now, this bill isn't going to help you. So that's another 1 million. I need to get my list. I'm doing this off the top of my head, so I need to get my list. I'll shout out to Topher Spiro. Alright, also under Trump care, if you're age 50 to 64, it is written in there that your insurer could charge you up to 5 times higher on your premium just because you're that age. That is discrimination. That's ageism. We don't have room for that in our country. So women who give birth in South Carolina, 60% of these births are covered by Medicaid. Giving birth to a child costs tens of thousands of dollars, and if the family can't pay because Medicaid is cut, hospitals have to pay, and that eventually comes back on all of us. That's for essential benefits, the millions that will lose those. So Trump Care actually writes in that states can get waivers for covering essential health benefits. Those include prescription drug pricing, emergency services, all sorts of things that you really rely on, they could take away from you. That's another 1 million. So that is for high-risk pools. Republicans love high-risk pools. They think they're the best thing ever. Thing is, they already existed. They were terrible. What happens is you get put in a high-risk pool for a condition, and they can deny you coverage in the high-risk pool for the condition that puts you in the high-risk pool. I don't even need to say anymore. That's just ridiculous. Another $1 million off coverage. Let me get my other shoe.
They're wet and stuff.
I know,
together.
my sheets all stick together. Should I hide it? Alright, let me find it. Alright, that $1 million. So, between Trump Care and the Trump budget, they want to take tons, millions and hundreds of millions of dollars away from disability insurance. For people that are disabled, Mick Mulvaney thinks, oh, you know what, you can probably just still go and work. We want to give you less help, but you go work because you're disabled. So, thanks, Mick. Mick. Another $1 million. So, let's see. So, Republicans aren't talking about how premiums were rising before the ACA. In fact, projections show that premiums would have been about the same for certain states under if the ACA had never happened, but other ones, when we lose our insurers, like we have one in South Carolina, those premiums rise, and Trump Care does nothing to actually fix premiums. It solves problems that aren't problems. They don't exist.
They're also not telling you that they've been sabotaging the ACA by withholding subsidies they promised to the insurance companies to run the markets. And Trump's doing even more of that now.
Thanks, Trump. If you're concerned about opioids, mental health treatment is an essential health benefit that could be denied if Trump Care passes as it is now. We all know the opioid epidemic is totally just heartbreaking in our country, and to deny people treatment because of that is just inhumane. Millions. That's for the people who have employer-based coverage. If you have insurance through your employer, you are not safe under Trump Care. They want you to think that you're safe under Trump Care, but you are not. If you have it through your employer, there is now in that bill a way for them to waive out of the requirement to cover people if they have, 25 or more people employed. So if you get insurance through your employer, you are also at risk. This is why everyone should care. It affects all of us. That one is for the millions of dollars that our state is going to have to pick up. That Joe and his cohorts want to shift all the spending to the states. When they shift it here, other programs that they're already responsible for are going to shrink, and services that we rely on are going to disappear. This one, I'll do for me. I've had type 1 diabetes since I was 9. It's an autoimmune condition if you don't know about it, but people who have lived with chronic illness for years have complications that start popping up after 20 years, and that cost just increases and increases. This bill does nothing to address how healthcare is priced, how it is ethically managed price-wise. It does nothing to help with that.
There's Butch Wilson, or Butch somebody, who doesn't care about our health care either, and told us that elections have consequences. So say hi to Butch.
Yeah.
Cold-hearted.
Yep, that was cool. So, hold on.
His last name might as well be Wilson. I can't think of what his last name is, though.
That balloon was for all the cancer survivors who have had their, especially cervical cancer, treated quickly because of Planned Parenthood, have gotten screens. Those people who, if they can't get early screenings, your chances of surviving are just so decreased, and taking away access from low-income women is just
wrong.
Reprehensible, yeah.
Mean, wrong, heartless, unchristian. We're on 10% battery, y'all.
That one is if you have expensive coverage and you need no lifetime caps, no annual limits. We need to make sure we pressure our senators to keep those protections in place, because the ACA did protect all people in certain ways, and we need to make sure that those protections stay in there. That one, who's that one for? Should we dedicate it to somebody?
Meals on Wheels.
Yeah. That's for seniors who rely on programs that they want to cut that actually really do impact health. Mick Mulvaney didn't understand that feeding people helps with health outcomes, but it is. It's all related. So, hey Mick, I got an axe to grind with you, sir. That one, That bubble bursting is for Republicans in general, who voted on this bill without a score, who voted on this bill without reading it, who
Boo to
voted on
Joe.
this bill and told us to read it, which we did. You didn't. You're going to lose your seats. And this last one is one special.
And
Joe.
boo on that kegger at the Capitol.
Yeah.
I just have to say that. Tacky, tacky, tacky. You are not frat boys.
Nope. Last one. Joe, that bubble was for you. I want to burst your bubble and let you know you will lose your seat in 2018 because you voted for this bill and you voted against the needs of so many of your constituents. As y'all see, we have some giant dollar sign balloons because there are people who win with Trump Care. If you're an insurer, you win. If you're a pharmaceutical company, you win. If you're one of the wealthiest families in America, you win. You get tax breaks while the rest of us suffer.
Yay, you can kill us for a new car or a yacht or a fancy beach house.
Unfortunately, we don't have the CBO numbers, so we don't know how much this bill will cost or save. Definitely. But we know it's going to cost the people who need the most help the most, and that's why we're here today.
We're not giving up.
To slow bleed. Republicans
Yeah, they're slowly bleeding the middle class and poor dry while they collect more money they don't need.
Exactly.
How much is enough?
I don't know. All right, well, I want to thank y'all for tuning in. I wish it had been a better day. We could have, really had our whole thing going. But thanks for tuning in. We'll be doing more events like this, fun. We call it Laughtivism, and even though it's pouring rain and I'm stoked, I'm still laughing. I'm still here, having a good time. So, anyways,
Woohoo!
Indivisible Midlands is out. Bye.
Bye.